All right, let's focus on gout. Now, please check out the video on the description below. It is Gout by Nucleus Medical Media. Awesome video. It's only about 3 minutes long. Great animations, so please check that video out and then come back to this lecture, because in this lecture I'm only going to focus on the interventions and medications that you need to know for the Nclex exam. So please go check that out and then come back. Now, just like on the video, gout is caused by an increased amounts of uric acid, either increased amounts of uric acid accumulation or production. So in number 2, we have under excretion by the kidneys. And simply put, again, the kidneys are going to be removing uric acid, but if the patient is suffering from some type of renal pathology, renal disease, acute kidney injury, maybe the patient is on dialysis, maybe the patient is diabetic, maybe the patient has hypertension, and their kidneys are beginning to decrease in function, then you will have an under excretion of uric acid, which will lead to an accumulation of uric acid in the body. So that's number 2. Or number 3, you have increased intake of foods that contain purines. Examples of this will include things like scallops, shrimp, crab meats, any of your shellfish. Also, patients may have large amounts of may consume large amounts of lentils or asparagus or spinach or red meats. Now, typically the patients that are affected by gout are middle-aged men. In fact, 90% of patients are middle-aged men. So make sure you know that for the Nclex exam. Let's focus on some clinical manifestations. Now, the video talked about acute gout attacks or acute gouty arthritis. Now, in the beginning of this video, I posted a couple of pictures. One of them was a foot. One of them, you saw that the big toe looked red, looked swollen. Typically in acute gout or in acute gouty arthritis, what is affected is the great toe. Now, again, this is the most common finding in acute gout attacks or acute gouty arthritis. So symptoms may include swelling, pain, or low-grade fever. Now, this typically occurs at night. This, however, is different from chronic gout. In chronic gout attacks or with chronic gout, you worry about multiple joint involvement. And just like in the video, we talked about urate crystals. Now, this clumping of these crystals result in tophi or tophus. Now, again, in the beginning of this video, I posted a couple of pictures that show a lot of bumps in the hands, in the feet, in the ankles. Well, that's what these urate crystals end up looking like. Now, again, this typically occurs in the chronic form of gout. Now, in these patients, if you were to draw some labs, you'd find that they'd have increased amounts of serum uric acid levels. Now, these large amounts of uric acid accumulation will result in these clustering or clumping of uric crystals or tophi. So if on the Nclex exam it asks you anything regarding tophi, tophus, make sure that you know that it is asking a question about gout. Now, these tophi or tophus may cause joint deformity. Again, look back at the images that I put with this video, and you'll see that those hands are actually deformed. The joints are actually deformed. What can also result is cartilage destruction. Now, because you have joint deformity and cartilage destruction, you have to worry about contractures, kind of like with rheumatoid arthritis. That'll be one of our interventions later on when we get to our section on treatments and interventions, is that you may have to immobilize these joints, again, to prevent contractures caused by these tophi. Now also, these large tophi, if you saw in the images that I posted, they can get so big that they can actually perforate the skin. Now, if that happens, what can result is infection. So some of these patients, the ones that have recurrent attacks, the large tophi present, will also suffer from recurrent infections. Now, this is very, very important, if especially the patient also has something like diabetes and they have recurrent infections. This could cause a lot of problems. Number 3, kidney stone formation due to increased uric acid levels. Now again, this will result in kidney stone formation, but what will also result is renal damage. Again, these stones can either cause an obstruction in the ureter. If that happens, you're going to have all of that urine accumulating in the kidney. Something like pyelonephritis or glomerulonephritis may result. If that happens again and again, you may actually end up with renal disease or chronic renal failure. So again, one of our goals is to decrease the amounts of uric acid levels in the body and hopefully prevent stone formation. So let's focus on a couple of diagnostic studies before we get into our treatments and interventions. Again, diagnostic studies. Number 1, serum uric acid levels will be greater than 6 or greater than 6 milligrams per deciliter if you want to be specific. Number 2, you may also obtain a 24-hour urine uric acid level. So you're going to be collecting urine for 24 hours. Again, with any 24-hour urine collection, if there is any void that is missed, the exam has to be started all over again. Number 3, joint aspiration may be performed. Number 4, x-rays may also be performed. Let's get into our treatments and interventions. Now, just like the video said, you may give something like colchicine, NSAIDs. Colchicine has an anti-inflammatory property. So again, the hope is to reduce inflammation, reduce the swelling. NSAIDs, they also have an anti-inflammatory property, but they provide pain relief. Colchicine does not provide pain relief on its own. So typically, colchicine is given with an NSAID. Corticosteroids may also be given. Again, corticosteroids have an anti-inflammatory property. So you may give something like Solumedrol, something like prednisone. But again, if you're going to give your corticosteroids, you have to monitor sugar levels, especially if the patient is diabetic, because you can cause hyperglycemia. Now, one thing to know about colchicine is that it typically takes about 24 to 48 hours to actually see some results, to see decrease in inflammation. Now, again, another thing that you must know about colchicine is that it causes diarrhea. That is one of the adverse effects of taking the medication. So, physicians may also prescribe some type of anti-diarrheal medication. Now, you always want to tell your patient to take these medications with food. If diarrhea does not stop, the colchicine may have to be discontinued or stopped. Same thing with NSAIDs. You must tell your patient to take it with food. Again, you do not want to cause ulcerations in the stomach. Again, typically colchicine and NSAIDs are given in an acute phase. Something like allopurinol or Alloprim may be given for an extended period of time. Again, one of the things that allopurinol does is it prevents uric acid stone formation, which is very, very important. We want to make sure we keep good kidney function. So again, we want to prevent stone formation. Some patients may not tolerate allopurinol, so they can be given something like oxypurinol. Patients may also be given something like Prebenecid or Benamid. Now, one thing to know about Benamid is that it may cause renal injury. And for this reason, patients must be informed to take 2 to 3 liters of fluid per day. Again, make sure you know this. Make sure you tell your patients to have an intake of fluids of about 2 to 3 liters per day. Very, very important for you to know. Patient may be also given some medication like Uric. This is typically given for chronic gout. Now, if on the Nclex exam it asks you for a gout or an IV gout medication, they may be talking about Crestexa. Now, in the video, I talked about how patients may be given aspirin. That is actually a no-no. You want to avoid aspirin. Aspirin can actually induce a gout attack. So again, you want to tell your patients to avoid aspirin. Now, you're going to be giving all of these medications or some medications, and the hope again is to bring uric acid levels down. So in order for you to know if your medications are actually having an effect on the patient is to monitor their serum uric acid levels. You will also tell your patient to avoid alcohol, any wine, any beer. And like I mentioned before, we have joint involvement, cartilage damage. So you may actually have to immobilize the joints. Again, preventing contractures. Just like the video talked about, you want to avoid caffeine. Caffeine is going to make you void a lot. And so will alcohol. So you want to avoid both of these things. You will tell your patient to again avoid foods such as red meats, shellfish, spinach, things that we talked about before. And last but not least, again, you want to inform your patient to drink plenty of fluids, again, 2 to 3 liters per day.